right, folks, and welcome back. And, this year it seems there's a lot of concern over changes in plans for Medicare. Lindsay Penrose is a certified Medicare specialist licensed with all major insurance companies in the Rochester area. She's local and with Benefit Representatives of America, assisting clients with getting set up properly with their Medicare benefits. She's been with us before. Welcome back, Lindsay Penrose.
Good morning, Mike, and hello, Joanna.
Good morning, Lindsay. It's so great to have you back. And I can tell you what a relief, folks, that I felt because I finally knew which Medicare plan was right because I tried to figure it out and it wasn't a good thing to do. And Lindsay helped me very much with that. So we asked her back to give us some straight facts on the 2025 Medicare landscape. So the first question is, of course, for those that are new, what is the annual enrollment period, Lindsay?
Well, Joanna, annual enrollment period runs from October 15th to December 7th. So right now we're a few weeks in. This is a set time each year when people who have Medicare can enroll or change health insurance plans. This is very important for those who have Medicare because each year the insurance policies do change. You do not have to make a change, but it's important to at least understand any changes that the insurance company may have made to your current plan. Insurance brokers like myself specialize in assisting clients with analyzing these changes and possibly looking if another plan could be a better fit for the following year. With all of these options available, it can get really confusing and overwhelming just trying to do it on your own.
I know you've said there's urgency too, and I want to ask you to explain to the folks what you mean when you say to us, act fast.
Oh, yeah, absolutely. So, since annual enrollment period ends December 7th, it's crucial that all Medicare plan changes are in by then. So, there's less than 2 months to make these changes and a lot of clients to assist. So, calendars book up really quickly for Medicare brokers. Calling early and getting that appointment scheduled will guarantee you are taken care of.
And Lindsay, there's been a lot of talk about this. What's different about Medicare in 2025 compared to other years?
So the Inflation Reduction Act was put into place for 2025, and there's now going to be a $2,000 annual cap on out-of-pocket prescription drug costs. So therefore, this is causing the insurance companies to relook at the plans that they currently have in place. Some people will be very surprised by how their plan could be affected. Everyone gets notified as of these changes, but I'm here as a resource to make sure that this plan is still the best option for you come 2025.
And how do you advise someone with there's so many different Medicare options?
Yeah, well, everyone has their own unique situation. So, with the help of my tools and the policies that I have, we can work to find which plan would hold the medical providers that you're currently seeing and the hospitals that you go to. So, depending on your medical and also financial situation, there's different plans to meet your needs.
And that is absolutely right. It's customized, really, is that's what you do, and that's what you help us wade through all that information. And I know people, you're getting it now if you are eligible or are new to Medicare. It's a barrage of information. So, Lindsay, you're fantastic to do this. And I guess people will be thinking right now, they might be afraid to ask. I'll throw a little Halloween in there. What's the charge for such an important service as yours?
Some people are afraid to ask, some people just come out and say it, but I'm happy to tell them that there's no charge for my service. This is one of the benefits of going through a Medicare broker like myself. The insurance company takes care of our commission.
Excellent. Thank you so much, Lindsay. Is there anything else you want to share before we go to break?
Well, I think if I were to share one important thing, it's double check your mailbox. A lot of my clients aren't getting their notices of the changes that are happening to their plans. They're just not checking their mailboxes. Everyone gets them from the companies, but I say this because there's quite a few plans that have actually been discontinued for 2025. So if you don't make a change, then you're not going to have the coverage come the new year. and you will have an extension into February, but you'll have a whole month without the insurance plan. So it's really important that you check and you give us a call if that's the situation you're in.
Whoa, that's very important. So if you want to talk to Lindsay, I have my stuff in my folder. We have an appointment already, but you guys should call her, contact her. She's at Benefit Reps of America. They're located at 1577 West Ridge Road, right next to the Red Lobster that's still open. And the number is 585-663-6333. Again, 585-663-6333. Thanks, Lindsay. We'll have you on soon again. Everyone needs your help. Mike,
All
what do you
right.
have to say?
Oh, well, just another example of where you got to talk to somebody who knows the ins and outs, because without the right information, you can be in trouble.
Absolutely. Have a great rest of your weekend, Lindsay.
Thank you
Yep,
for
thanks
having me.
again. Thanks again for joining us.